Bonnie Bishop tells us why a psychiatric residential treatment facility where it is and why Maine doesn't have one.
Psychiatric residential treatment facilities, or PRTFs, are secure therapeutic residencies for youth 21 and under. Without a PRTF, families are given limited options on how to best take care of their child's mental health needs. They can send them out of state to an area that has a PRTF, or they can try using in-state resources, including emergency room visits. Michelle Richardson's daughter has spent nearly 2 months in an emergency department. Her daughter was kept in a hallway for nearly 2 weeks.
They have since been able to move her into her own room. It has no windows, it has no access to outside. It's extremely limited, not therapeutic, not beneficial.
Since 2015, over 30 states in the U.S. have had at least one PRTF for youth. Nearly a decade later, Maine has still not secured a spot on that list. Neighboring states like Vermont and New Hampshire also don't have PRTFs, which makes sending a child to one nearby impossible. Within that decade, the number of youths in crisis has increased.
We've gone from seeing like 100 to 200 kids a year in the emergency room for crisis assessment back, about a decade ago, to last year we saw over 700 youth in crisis in the emergency room.
The main barrier is a lack of funding to create and maintain one of these facilities in Maine. The Maine Department of Health and Human Services Committee unanimously voted to support funding a PRTF. If funding gets approved, Sweetser says a facility in Maine should be up and running within 8 to 9 months.
Is really a level of care that we desperately need in Maine. These kids need to be brought home where their families are, where their friends are, where their communities are. We should not be sending kids out of state.
I'm Bonnie Bishop for Maine's Total Coverage.